Today's ICD-10 quick coding tip focuses on answering the question of whether or not it's appropriate to code obesity and overweight when they're mentioned in the medical record without any further documentation to support their clinical significance. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Obesity is often noted in medical records without any additional information to confirm its clinical significance. This leaves coders unsure about whether they should include the code for obesity or not. However, according to Coding Clinic from third quarter 2011, the answer is yes. Obesity should always be coded if it is documented in the medical record. According to the Coding Clinic, individuals who are overweight, obese, or morbidly obese are at a higher risk for certain medical conditions compared to those of normal weight. Therefore, these conditions are always considered clinically significant and should be reported when documented by the provider. So next time you find obesity documented in a medical record, don't hesitate to code it. It's an important piece of information that can help healthcare professionals better understand a patient's health risks. So based on the previously mentioned Coding Clinic, we know that obesity is always considered clinically significant. But what about being overweight? The Coding Clinic I just referenced states that individuals who are overweight, obese, and morbidly obese are at an increased risk for certain medical conditions compared to those of normal weight. Therefore, these conditions are always considered clinically significant and should be reported when documented by the provider. However, there is a more recent Coding Clinic that has some updated advice specifically for a diagnosis of being overweight. According to the newer Coding Clinic, which takes precedence over previously published advice, the diagnosis of overweight is not always considered clinically significant and should only be reported if it meets the definition of a reportable secondary diagnosis. For inpatient coding, a reportable secondary diagnosis refers to additional conditions that have an impact on patient care requiring clinical evaluation by the physician, therapeutic treatment, diagnostic procedures, extends the length of the hospital stay, or requires increased nursing care or monitoring. To give you an example, if the physician states that a patient is overweight without any further details, this diagnosis shouldn't be coded. However, if the physician documents that the patient is overweight and that their weight is negatively impacting their health, and so they order a nutrition consult for weight loss, then the diagnosis would meet the criteria for being reported as a secondary diagnosis. So to sum it up, when obesity is documented in the record, it is always considered to be clinically significant and you should code it. If overweight is documented in the record, you should evaluate it to see if it meets the definition of a reportable secondary diagnosis, and only then, if it does meet that definition, you may code it. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.